hand hygiene. I go in, I provide privacy for my patient. I introduce myself. Hi, my name is Mohammed, and I'll be doing your wound assessment and sterile fill with sterile. And do I have your permission to do that? The patient gives me consent. I would ask him for his date of birth and a name to identify him. And once I do that, I will raise the bed to our working level. And once I do that, I will put on my gloves. I put on my gloves. Okay, I would give the patient some dignity by covering him up. I will look at the wound, and I would take the old cloth off from the 2-inch place, moving it. I'll take what's inside and dispose of this in the garbage. Once I do that, I will now do another hand hygiene, and I would assess the wound. And I would use Rita, and I would look for redness, which indicates there's redness here, which indicates inflammation and infections. I would also look for edema, which indicates swelling, and I see a little bit of swelling, but not much here. And I would also use the other emusha, which indicates bruising or discoloration, which means it could be bleeding from the inside, and affirmation, which means how is the wound healing, is there any gaps or any openings. And once I assess all of that, I will clean this up, and then I would dress it back up. And once I do that, we'll put on the new dressing, and when I clean it from the in and out, not from out and in, bringing new bacteria. Then I would dress it with the new wound and put that back on. It's all new. Then I would cover the patient up. Now I'm going to be doing my sterile field, and everything within the sterile field has to be sterilized. So I gotta do high hygiene again.
So now,
I would clean my hand, start with hand hygiene. I would have a clean surface. I would open the bag, and I would bring my container, my work container. And I would tape this and use it as my dispenser. So everything I do here is I touch the 2-inch borders, which is everything that I could touch. So I grab, I open it, 2-inch, 2-inch, grab the 2-inch, and at this moment I grab this thing and I grab it from here. Okay, I can grab anything at 2-inch just to make this possible. At this moment, I can use this to see my supplies inside. And when I'm not using it, I put it here. If I want to introduce new materials to the place, I grab it, I open it from the 2-inch border. I open it, and I bring it to the place. And I also dispose of this. I need this, my gloves. I open it. And I take it, and I go like that, and I open it. And I can put it there because the gloves is still inside. At this moment, I want to bring my gloves, and I can touch the 2-inch border, and I can open it. And I cannot touch anything within this place. So I will take my strong hand and I'll pick up the gloves. gloves are stuck together. The gloves stuck together. Oh, I can use this. I can use this. The gloves are stuck together. But I won't introduce that. That part is sanitized. I would go inside the gloves. And I could touch the inside, not the outside. And I put the glove on. There. And I take my glove and I grab this one and I go. And I put on my gloves. At this moment I have my gloves were kind of attached. And I gotta keep my hands here, and that's how you do it. Thank you.